Hello, I'm Ethan from Birdman Strength.
And I'm Andy from Brotherhood Health and Performance. And today we're going to look at the inside heel hook, the mechanics behind the submission, and how that relates to the injuries that we can pick up from it.
Once we've had a look at the structures that are involved in the submission, we're going to look a little bit at the rehab.
It's always important then when we're looking at submissions in relation to any part of the body, that when we're considering submissions on a distal joint, so a joint that's far away from the body, there's certain mechanics that go into that in terms of how we create braking force. When it comes to the inside heel hook, obviously what we're trying to ultimately do is create damage or pressure or tension on the knee joint itself. When we are looking at creating that damage, we want to make sure that we've got anchors on either side of the joint to create that leverage strong enough to facilitate a break. The way we do that, first and foremost, is we are going to look at locking down the hip, and then we're going to look at locking down the ankle as well. What this allows us to do is create points of tension on either side, so that when we apply force through the knee, it creates sufficient tension in order to do damage internally from that. There's a couple of key parts within this submission itself in terms of where injury can occur due to the nature of it, but it's also one of the reasons why these submissions are so effective in terms of doing damage. So obviously when we're in the position, obviously today we're not going to walk you through the entirety of an inside heel hook technique, but what we're going to look at doing is analysing where the issues can occur. So obviously we've got Ethan's hip locked in place here using my leg with the sort of internal triangle position. And what we're going to look to do is we're going to look to hook the heel. Just shift your hip a little bit for me, Ethan. This way, mate. Just come up a bit more. That's it. Perfect. Okay, so from this position here, what I'm looking to do is, again, create tension on either side of the joint so that we can create the braking force through the midline. So I've got my legs locked in place and I'm looking to hook the heel. And to further this point, I'm going to drop my weight onto the heel from this position here. Now, when it comes to the braking mechanics of the submission, from there what I would look to do is bridge up and drive my hip through into Ethan's knee. Essentially what I'm trying to do here is create a degree of what we'd call a valgus position. So a valgus position is where Ethan's knee line is going to travel internally away from the hip and the ankle line. So this essentially is what's going to create that braking pressure from there. And there's a few things that we need to look at in terms of the damage that we can do from this position. Now we're going to look a little bit more at the sort of internal damage that we can do to the structures and the sort of leverages that we're manipulating in order to cause damage. So obviously when we're in this position, now depending on the individual's full position, whether we're a bit more rotated or whether we are planted in this sort of motion, is going to sort of dictate where the damage is going to be done and which joint it favours, whether it be a bit more knee-based or whether it be a bit more ankle-based. Whenever we're in a position on our side and we've got the heel pinned and the hip pinned, then the majority of the force is going to be focused on the knee. Now the most occurring injuries that you'll probably find within this position are going to be relative to the MCL, which is this big fibrous ligament on the side of the knee, the ACL, which is internally of the knee. You've got the pes anserinus, which is an attachment through the back of the knee here. And these are all quite heavily influenced by rotation through the knee. So obviously when we come into that position and I load the ankle, plant my heels against his hip and then start to drive into that knee, I'm creating that rotational force, which is going to lead to the breaking of those ligaments. Now, when we turn to our side slightly a little bit more, say for example, Ethan's looking at defending the position, what we might see in this sort of situation is that the force changes to the ankle a little bit, okay? Because obviously in this instance, due to the positioning of Ethan's knee, I'm much more locked on his knee, much more locked on his hip, and the rotation starts to come through that ankle itself. So within this situation, we're going to get a lot of pressure down the medial side of the ankle, so these ligaments that run inside of the ankle. We also might find that we have issues with the toe joint itself. When you're sort of torquing that foot and lifting the heel, then we might start to see some pressure and injuries occurring from that position itself.
Okay, so with the inside heel hook, like Hardy said, the primary force is this valgus force, and you can already see as I do that this massive ligament, the MCL, is getting put on a stretch. We've also got this element of rotation. That's also going to stress the MCL and the ACL, which you can just about see here. And if we rotate enough, the LCL too is going to be under stress. We've also got muscles. These two dots in this line represent the insertion of the pes anserinus. That's the gracilis, sartorius, and semitendinosus muscles. When we get going into this excessive external rotation of valgus, we're putting a lot of stress on those structures, and we can get a strain of the tendon. Now let's look a bit more at the ankle. So, like Hardy said, the medial ligaments are going to be under stress when we've got this kind of reverse toe hold position. It's the opposite of a toe hold. The main medial ligaments are called the deltoid ligament. And so yes, when we go into excessive eversion, they're going to be on great stress, great stretch, as you can just about see there.
So obviously, before we move on to giving recommendations from a rehabilitation standpoint, it's important to note that these submissions are effective for a reason. They're very efficient in the way that they're utilised and the mechanics behind them in terms of doing damage to your limbs. So the best advice we can give you is about monitoring your training properly, making good decisions when you're on the mats, tapping early and knowing the positions that you're in before you start to try daft things to get out of them. This is where most of the injuries will occur, especially when you're dealing with an uncontrollable opponent that is trying to inflict damage on you.
So speaking about the inside heel hook, we now know that there's damage at the ligaments of the knee and the ankle. So when we're approaching this from an early rehabilitation standpoint, one of the first things we're going to notice is we might have instability at both joints, and we're going to have a lot of swelling. So the first thing is to try and reduce swelling and get weight bearing as soon as possible. If you can weight bear straight away fully, fantastic. If you need to use one crutch or two crutches, whatever we need, but we want to get weight bearing as soon as possible. I'm going to try and get our quads activated as soon as possible. So exercises like the terminal knee extensions, stiff leg raises, to try and activate those quadriceps and get full extension back. And then we want to try and gradually increase the flexibility of the knee as well in flexion. So once we've got good quadriceps activation and we're starting to get more flexibility back into knee flexion, we can move on to some more progressive rehab.
It's quite challenging to make specific recommendations to you. A lot of the rehabilitation will be based around you and your progression through that rehabilitation. But obviously once we move past that, we come into the sort of utilisation of strength movements in order to keep our joints healthy and improve the robustness of those structures. A lot of the time this comes from general movement patterns that we would see in everyday gym routines or programs, in terms of making sure that we're keeping our quads healthy from the VMO, which is the smaller muscle associated with the knee, all the way to the upper quads, making sure that we're working our hamstrings, our hip flexor muscles, and all the muscles that are surrounding the calf and the ankle themselves. This is obviously going to give us the best opportunity to keep those joints safe in the long run, provide us with the robustness and the ability to resist external forces when things are applied upon them and when we're in certain positions that may not be the most efficient from a biomechanical standpoint.